Oh, all right. So we have Bridget Carey. She's going to be speaking about corporate confidence, how nurses can pivot, communicate, and succeed. And we'll let you get right on it. Thank
All
you.
right, we will get on it. Thanks, Olivia. So the title is different. Yes, it is. Because I really wanted to try to really succinctify what corporate nuance, corporate communication, what that actually means. So I'm so glad you're here and sticking around. For those East Coasters like myself, it's 7 o'clock. I'm so happy you're here. I'm so happy everyone's here. So what I'm going to do, I'm going to try and cram as much as possible into the next 30 minutes because each of these topics I could really sit and talk about for half hour, 45 minutes, an hour each, just because they're so important and I'm pretty passionate about communication. And this was something I found my passion from remote nursing. So let's find a roadmap. This is going to keep me honest and keep me on track. Things we're going to connect with, communication shift that happens from bedside and when you go to remote, whether that's corporate, whether that's a different remote position, talking about the differences there. Then we're going to jump to corporate nuance. That's a fancy way of saying corporate culture, the differences and the nuances that we may be blind to as bedside nurses coming into that space. And then finally, mentorship and wrapping that up in a bow of why that's important. So my goal for you, everyone here today, is I hope you can get one nugget, just one gleaned piece of information that you can take back to either your practice or something that you can kind of like chew on that may propel you in your career as you move forward. So hi, I'm Bridget. Who is this woman that is standing here chatting with you this evening? Tried to just kind of summarize my zigzag of a journey as a nurse. And I have been a nurse. I've been an RN for 15 years. And I'd like to think that I really have taken advantage of my licensure and really navigated this space and really capitalized on that. So I have worked clinically in pediatric acute care. That is most of my clinical experience, as well as pediatric home care. And I did a stint in adult long-term care. So that's clinical, where I look at the remote world in remote fashion. I've done something remotely for the past 10 years. That does include adjunct faculty and clinical instructor. I was a clinical specialist in the pharma med device industry, which catapulted me into a medical education manager position. So that allowed me to see the side of interviewing and really reviewing what people, I don't say are capable of, but seeing the opportunities that are available for bedside nurses ready to leave that position and explore something else. I'm a published medical writer. This past fall, I was part of a group that we published a nursing textbook, which is really interesting coming from my own nursing background as a student, which has been touched on how hard we work as students and in our careers to get to where we are. So that was an honor to be able to participate in that project. And currently, yes, I have a lot of energy. I am also a legal nurse consultant. So that is one of my new remote pivot adventures and also an amazing opportunity to explore if that's something, if you're not interested in the thousands, I say thousands, the thousands of other opportunities available for nurses to utilize their license. And a nurse career coach, which all that means is that I really enjoy having the conversations and helping nurses guide their mindset, guide their trajectory in their career, and to really maximize your license and your adventure. So why does this conversation matter? Why do we care? Why is Bridget talking about communication and best practices on how to talk to people? Why does this matter? Well, why does this conference matter? Why do these skills matter? Why does Jules, with her amazing presentation that I just was on, and hopefully some of you guys were too, on burnout, why do these things matter? Because you matter. Your success matters. And all of these things together, we want to help you bridge the gap that maybe we had on our journeys from bedside to remote, and hopefully to kind of quicken that journey for you, if you will. So let's jump in. So communication style shift. What does this mean? Well, when we're bedside nurses, and some of us who are, and some of us who still dabble, we are in it. We are able to communicate our needs, be able to read our body language of our teammates, of our patients, and get done what needs to get done. Really, that's what it is. There's not a lot of barriers. If a patient needs a medication, they need a new order, you go talk to the provider. If pharmacy didn't send the med or got lost in the tube system, you call pharmacy. You have that quick conversation to get things done when they need to get done. When you move to remote, it's almost like a slowdown. It's a little bit of a shift. You don't have that immediate opportunity to read body language, to read how somebody is communicating or putting something forward. So all that really means, and what that, I shouldn't say all, because it's pretty something that we want to keep in front of our minds. Everything we do, every which way we communicate carries weight, from your text message, from your emails, from the way you show up on calls, if you're on video. So again, like all these communication components really affect how you are perceived. And at bedside, perception is not, it's important, but it doesn't carry a lot of weight. Okay. But when you get into the remote space, when you get into the corporate world, perception precedes you. So every which way that you show up, someone has an idea of who you are, how you speak, and what you stand for. And that says, whoa, Bridge, that sounds like we're judging. It's not so much judging, it's just a different culture. And that's what we're talking about right now. It's a different way of functioning and a different way that we just need to elevate our roles as individuals and professionals. Now, back when I started, LinkedIn wasn't really as big and important and a critical tool as it is now. But Facebook was kind of interesting when I started remote nursing. But the same rules and same tidbits apply. How you show up online, how you show up on social media also affects your perception and your professionalism. So that's something we want to keep in mind. So we gotta go back. Using Canva, not really good with that. So I'm gonna pause. I'm gonna let that sink in. Everything you do and say and how you say it or how you are perceived to be saying it affects how you can climb the ladder or how you will be successful in your role. That's not meant to be heavy. That's just meant to kind of shake things up because, again, that's not something we're typically used to as bedside nurses. Some pitfalls, and I have them here because I like to make myself little post-its. So some common pitfalls that I have seen, some setbacks that I've experienced in my role as a remote nurse on my journey from bedside to remote. Overly relying on that telecommunication, that writing. If something is not being communicated or you feel you're not being heard, pick up the phone. Now, I know that that's kind of like we do that in real life outside of our professional life, but that also is just as critical. If you're trying to communicate a need and it's just not landing or the imperativeness is not landing, pick up the phone and call. Save everybody some time and some miscommunication. Other pitfalls, not advocating for yourself as a professional. So what that means is because we are remote, because we are more, or for hybrid, you're more in an office setting than with people, you're not able to discuss your wins, discuss opportunities, discuss ways that you want to elevate your own career path. So how do you do it? Talk to people. Talk to your manager. When you have those one-on-ones, you want to be able to advocate for yourself and advocate what you want to do and ask for feedback. Feedback is something that I personally had to learn how to accept. And sometimes when we have setbacks or if we're not picking up a skill as quickly as we want, we think of it as a failure or something that, maybe this isn't for me. I don't think about failures or missteps as negative. I see it as feedback. Everything is feedback. And really the opportunity is, what are you going to do with that feedback? Okay. So whether that's from a miscommunication or actually asking, hey, this is how the situation happened. How could I have handled it better? And you take that and you move along. Misread tone. Oof, how many times I've done it with text messages, but misreading the tone of a message or a communication can really shake up a relationship unintentionally. So way to mitigate that, you want to make sure that when you're communicating, you are clear. You're always professional. And lack of better terms, you always want to be positive. So we used to, not joke, we joked about this when I worked in corporate, but it's true. And this is not to be Pollyanna or anything, but we talk about the positive sandwich, okay? And you may have heard this, you may, if you're in a manager or managerial role, it's something that is used, but you can never go wrong by utilizing this tactic. So if you're writing a message and say there was a miscommunication with either a teammate, a provider, a customer, when you are communicating with either your superior or someone that is reaching out to you, say, hey, just wanted to let you know this is a situation that happened. I would like to discuss an opportunity, I want to discuss opportunity to bring this to light. So and so may have misconstrued the way I presented myself and wrote the wrong order. Okay. That's positive, negative. I see this as a learning opportunity and would love to see how I can prevent this in the future. Now that was really off the top of my head. That's why I'm like blanking up, but you can see where starting with a positive, bringing the situation that is usually in a negative connotation to light, but then turning it around and using it as a learning opportunity. That's the positive sandwich. And then the other pitfall that I see, and I have been fault to it as well, especially when everything went virtual in 2020, when, I don't know about you, but we had a lot of our holiday get-togethers, Zoom calls with loved ones, which is great. But just like we have alarm fatigue at bedside, there is Zoom and Teams fatigue in the remote world. And when that comes into play, people just tend to step back and not engage. And that is not a great move if you're looking to further your career and really establish yourself as a leader, a thought leader, whatever you want to eventually get to. So how do you do that? Make yourself known and not in a creepy way. You can turn your video on. Those weekly, monthly meetings, make an attempt to be on camera, especially in the beginning, just so people get to know your face, get to know who you are, participate, introduce yourself, ask questions, be a human, right? Like that helps to create that engagement and kind of solidify your role within the team. And team dynamics are very critical to culture and success in remote world. All right, so I have a not official thing. This is just something I kind of made up that kind of translate and demonstrate what I mean about clear communication. Subject, question about patient discharge. This is from a case management perspective. Reviewing discharge plan for Mr. John Doe. Noticed there were some things that seemed a little unclear. I wasn't sure whether he would be discharged. I'm not going to read this all to you. You can kind of read. I'll give you a second. I know you're busy, but could you clarify? Let me know what you think. All right. When I transitioned into remote nursing, I kind of had some similar verbiage here. And sometimes I still do when I am reaching out to new prospects for a potential writing opportunity or engaging with clients and attorneys and having conversations where I have to kind of present something that is not too comfortable to discuss. Hey, we're questioning somebody's recommendations. This is how I would rewrite that. You want to make sure that not only are you clear, but you want to be authoritative, right? You don't want to think. Let me go back. I know you're busy, but could you clarify? I'm not trying to hurt anybody's feelings. Listen, this is where we are. I would love if you could clarify this for me. Dear Dr. Smith. Now, this is just to show the stark contrast of what messages could look like or how you could improve them. The Dear Dr. Smith, I say hi in my greeting. I'll say with joy or talk to you soon or something a little more personal with my outgoing message. But that's going to depend, and we'll talk about culture. It's going to talk about your company culture. It's going to talk about how you are in a relationship, in a working relationship with that individual. It all depends. It doesn't always need to be very button up tight, but there needs to be a line of respect and continuity in the conversation. And you always want to make sure that you, when you're signing off, you want to say who you are, what your role is, and it's not on here, but typically contact information. What's the best way to contact you? Now, sometimes companies will have their own standard as part of their culture. They'll give you a signature that you must include, or there's certain font that you must use when you're writing messages, or have their own template. But if you're just winging it and you're going out, keep it as clear, as succinct as possible, and be confident in what you're asking. Similar to how you are at bedside. Hey, I know that room 2, we wouldn't say getting a little funky in a message, but communicating that need and making sure that the information is translated and done is important. So circling up some best practices. We want to master that clear and concise written communication, whether that's in Slack, whether that's in an email, whether that's in a phone call, right? You want to develop strong verbal communications for virtual meetings. Practice, and I know this was mentioned in other sessions, practice getting on camera. Make sure that we're not super close. Make sure that we're monitoring our mute buttons, our cameras, our background images and noises, things of that nature. Get comfortable with asynchronous communication. I didn't really go into this, but responses in remote world, in the corporate world, they run on their own timeline. It's not always as immediate. It's not always as emergent. Life and death situations that we're used to at bedside, it's a good thing, but it's also different and something that we almost need to retrain our body to know that this is not an emergency. It'll take time and that's okay. But ensuring that we're still prompt in that communication. Communicate data and reports effectively. That comes with training, and then maintaining professionalism in digital communication. Yes. All right. So I kind of alluded, we're going to jump on into understanding the corporate nuance, keeping my eye on the time. Basically, what this is just the invisible rules. And what that really means for nurses is that when we're going from bedside, when we're more, this is just cutting it black and white, reactive. We know sometimes we're more preventative and proactive, but at bedside work, really, we're reactive. We're reacting to the patient, to what's going on with them and taking care of them. Whereas in the remote world, it's more proactive. There's more structured tasks. There's more structured expectations and laid out instead of putting out fires. Now, that's not to say there's not fires to put out, but it's not as immediate. One of the things that I struggled with when I transferred into remote nursing was understanding the hierarchies. And what that means is like who you're CCing, who you're speaking to, because again, at bedside, if I need to talk to the surgeon, I would call the surgeon, or I'd call the fellow and be like, hey, I need some help. Well, in the corporate world, you have to understand who do you go to next. And it sounds like a lot of games and a lot of runaround, but that's because, again, we're used to a different standard at bedside. Understanding what the corporate world and how it functions is pretty critical to your success and continued success as a remote nurse. Performance is tracked differently. KPIs, key performance indicators. And I know there's been conversation of like sometimes there's companies are so strict and so focused on these KPIs that they're not really looking at the person. But that's something, again, when you're interviewing or looking into these roles, look at that culture, look at what they expect of you as an employee, as a nurse in that role and what that can be. So I put this little segue in. Remote nursing is a skill. wherever you go, wherever you are. It is a skill and it's something that can be honed. It can grow. You can go deep. You can go wide. It's just something, there's always something to learn, which is exciting. Yeah, it's exciting. There's nothing else. It's an exciting thing. So how do we survive? How do we survive all of these changes? And it's like, whoa, Bridget, you're dumping a lot on me. What? I just want to try something new. Well, mentorship. And I'm not talking about preceptors. You will have preceptors, which are amazing people. And if you're a preceptor, bless you because you do great work. What I'm talking about is mentorship. And what a mentor is a guide. Basically, I call them the lighthouse. They're the lighthouse that kind of show you the way, help you with the transition, excuse me, and help you as you move in your career. And if you're looking to a next step, helping to prepare you to get there. And it's more of a relationship development rather than a one-time like a preceptor. Now, there's all different types of mentors. This kind of strategically breaks them down into 5 different types. There's all different types. One mentor may integrate all of these different types together, and that's okay. But peer mentor is someone who recently transitioned and can offer that real-time advice. Maybe someone just had a promotion and you took their position. They could, give you feedback, give you guidance. Industry expert, excuse me, either somebody in your organization or adjacent to help, show you long-term growth or help you through that process. You have your skill-based mentor, networking, looking at you, LinkedIn. We've been talking about LinkedIn a lot as an incredible tool. Yes, as a legal nurse consultant, I found many amazing mentors from LinkedIn and having conversations. And I know that's been a theme across the whole day, as well as having the conversations with people in the field, in positions you want to be in. Asking people to be mentors is one of a great opportunity to see your career grow. And it's reciprocal. It supports them as well. They're able to give back and assist and learn, and it's like a nice little relationship weave and wobble there. And then organizational, help you navigate company culture. Again, these can all kind of intertwine together. And I just want to break out here the difference between mentorship and coaching. Now, I looked up, is that coaching is short-term structured sessions? Like, yes, to a degree. Coaching does not have to be someone at your company, does not need to be someone in your industry. A coach is somebody who is an objective individual that can help you and guide you through strategies and sessions to figure out what you want from your career. Whereas mentorship can give you the immediate task and that immediate assistance and handling to guide you through that. So yes, there is space and, different times and different places for coaches and different times and places for mentors. I have had both throughout my remote nursing career. I've had amazing mentors. When I was in the pharma company, I eventually, I knew and learned my strengths. I did not want to be a people manager. And I saw that there was an opportunity to manage products, and the clinical medical education manager was retiring. And I reached out to her and was like, hey, could I learn with you? Could you show me? And that's how she became one of my amazing, even to this day, mentors. I can reach out and ask questions like how to approach a situation from a public, speaking perspective or what have you. So, excuse me. I think my throat's telling me I'm almost up at time, which is true. So just to kind of put it in your ear, that mentorship, the lighthouse that helps you in your career, coaching, almost like that preventative medicine, that maintenance medicine that helps you figure out, what kind of role you're looking for, how to prepare for those interviews, how to build your confidence and overcome those imposter syndromes and all of that. So again, 2 very different, tools. People can be tools, right? Tools in your toolkit to help you navigate your career transition. Okay, takeaways. I had another slide. I'll be like, hey, what's your takeaways? But we didn't have the chat. So I'm just going to give you a couple takeaways. Your communication must be clear, professional, and structured. A shift in your mindset, going from bedside to remote, wherever that is in the world, is a must. And mentorship can guide you on your journey, your lighthouse, to help you with that transition and that career trajectory. And that, I'm going to stop. Oh, there's a thing. If you want to connect with me on LinkedIn, I got a little fancy here with the QR code.
That's awesome, Bridget. Thank you so much. I see
Yes.
that there's a hand raised in the audience, but we're not doing any audio or verbal questions. So
Yep.
who's raising if the person who's raising their hand could just type a quick question in the Q&A, that would be great. That's how we're addressing questions today and tomorrow.
I'm going to stop sharing there. There I am.
Wonderful talk. Wow, so much of that really resonates. Having been in the corporate world for now probably 15 years myself, so many things there that just were spot on and either made the hair stand up on the back of my neck or like made me feel like I was doing the right thing. But so yeah, I mean, just there's a whole like you said, there's a whole session that you could even go into just on performance and productivity and OKRs and KPIs. And this is a world that is
And things that I did wrong.
yeah, right. And just even the subtleties of being on mute at the right times and the wrong times on a call, and not realizing that you didn't check your teeth before you got too close to the camera, and all kinds of things like that. But yeah, let's see if any questions have come through. But yeah, so much resonated, and just so many ideas for additional talks in the future, Bridget. So good.
Good. No, I'm glad. That's what I'm like. And I usually do a disclaimer in the beginning, so I apologize that I am from Philly and I have been told in a lot of my feedback that I need to slow down. So I usually say if I'm going too fast, pump the brakes or give me a signal, but we go with it. We're good.
Awesome. No, it was great, and people can always replay this on slow-mo if
Slow.
Olivia, I'm not sure if you're off mute
Hello.
or if you had any thoughts or something while we see if there's any questions that do come in.
No, I loved it. Yeah, that could have been 3 hour long sessions probably very easily. And it jogged my mind as well, from being at 23andMe for sure. And then in some of my clinical research roles. Because I think you can be more within a corporate kind of setting, even within, the hospitals, right? Especially if you're in leadership. But then there are nursing roles like clinical research and such that they do kind of operate a little bit differently than bedside. But I thought it was interesting how you framed nursing as being more reactive and then remote work is more proactive. I definitely can see that. And I, was thinking about Jules's talk and like what motivates you, when you're kind of thinking about the world you want to go to. And I think that's a really good question to ask yourself. Are you motivated? Do you feel good in more of a reactive environment, kind of like bedside nursing where, there's very clear tasks that need to be done in a certain time frame. They kind of push you to do it. It's very like externally motivated, right?
Mm-hmm.
And you have to be reactive to what the patient's needs are and your team's needs are, and you can't really predict it, right?
Mm-hmm.
Or in more of a corporate role where there's more project-based work, where you have a goal, that's due in a couple months, you really have to be internally motivated. You really have to like be okay with mapping out how you spend your time and be more proactive about getting this stuff done. And that's really two different ways of like living, in a lot of ways. So that's another question for the nurses listening, to ask yourself when you're looking for roles in corporate, remote versus more bedside. And then even within the remote world, can you find a kind of more reactive role, like maybe triage or something, could be a good fit. So I thought that was a really good way to frame it. I like that you brought up the positive sandwich. That is a really good tool. But it's
Yes.
also the hardest, don't you think? Like
It
to
is.
be in those positions and use those tools is so difficult. And to
It's
receive it too.
hard. It's a skill. You have to, and without sounding like you're blowing smoke, for lack of better terms. Like it's a way, it's a nuanced way. And that was something I really received a lot of feedback in the beginning on, because as a writer, I know how to write, I know how to communicate, and I know how to get my point across. But that doesn't always mean it translates well. And how you're perceived, I know, and you guys have worked in corporate, it's how you're perceived is how you're going to be successful or not. And there's always an opportunity to like fix, like, hey, and having conversations, like that's the whole point. That's how we interact with each other. So it's interesting. And I hope that as I'm going through and I kept pausing because I'm like, oh, this central negative. Oh, this is like, I think this is an amazing opportunity. Now, remember, I've been doing this for 10 years and navigating this. And I'm still learning. Like in the legal nurse consulting world, it is absolutely different. New, like different nuances and communications and things like that. So it's exciting because there's always something to learn.
Yeah, absolutely. So. All right. Well, no questions, and that's okay.
That's awesome. No, and if anybody has, like, I'll give Jules. I loved her little sidebar. If there's something that you're like, I don't really want to ask this now. It's been, we had an amazing day. You can message me. You can I'm whatever.
Great.
Whatever helps.
Thank you so much. It was great. So much more to dive into.